Good evening. I'm sure most of you have seen on TV where a doctor or a paramedic has to intubate a patient to save his life. It's usually not a very good depiction of how it actually happens, but fortunately I can demonstrate that for you today. But first, let's go over some of the reasons why you must intubate a patient. Primarily, the number one reason would be for apnea, or the patient is not breathing. Other reasons could be severe respiratory distress, or they have a loss of consciousness, leaving them unable to protect their airway. Throughout my career, I've had the opportunity to intubate several patients in the field and even teach new paramedics how to intubate. It's proven that your successful intubation in the field has obvious better outcomes for your patients. Even though this is a pretty invasive skill, the steps are relatively simple. Before any intubation attempts, you want to make sure you have all your equipment ready while pre-oxygenating your patient at the same time. So go ahead and covering the first step would be to pre-oxygenate your patient. So you're going to grab your two first pieces of equipment, which is a BVM, bag valve mask, OPA, oral pharyngeal airway. You'll insert the airway, which keeps the tongue out of the airway. This is considered a BLS airway here. And you will pre-oxygenate your patient. You'll turn that over. Somebody will continue doing that. We'll pretend we've got a partner today. Now, while they're doing that, giving this patient some oxygen while we're gathering all our equipment. First thing you'll want to get is your ET tube. They come in different sizes for different size patients. It has a stylet in it, which makes it kind of rigid to help with placement. A syringe to blow your cuff up, your distal cuff on your tube. Once it's in place, you'll blow that cuff up, and that helps hold it in place. Remove that. So we want to go ahead and have that in place and ready to go. All right, got that ready. Get your laryngoscope with blade. Make sure your light works. This is a Macintosh 3 blade. Some of them are straight, some of them are curved. This is just one I prefer. There's many different sizes, again, for different size patients. And you will want a tube holder. Once you have successful intubation, you'll use this to hold the tube into place. All right, so now once we have all our equipment gathered, we got it assembled, ready to go, it's time to intubate. So now once you have the BVM ventilations going, we're going to tell the partner to stop, remove the OPA, get your laryngoscope. Insert it to the point of the vallecula and pull up to where you can visualize your vocal cords. Grab your tube and insert it through the vocal cords. That's called visual confirmation when you see it go through the vocal cords. Then you can remove your stylet, inflate your cuff. Then you can use your same BVM, just take your mask off. Give it a couple practice breaths. Make sure you got good placement. You should be seeing the chest rise and fall. You're looking for condensation in the tube. Once you've got good placement, we're going to take and secure our tube into place, because as the patient's going to be moving around, transporting all that stuff, we don't want our tube to become dislodged. So always make sure we've got our tube secured just like that, and voila, your patient is now successfully intubated. So as you can see, having all your equipment ready, visualizing the airway, confirming placement will usually lead to successful outcomes. Also building your confidence at the same time. This provides better outcomes for the patient, and like any skill, practice makes perfect, but like the old saying goes, do not try this at home. All right, good.